Welcome to Founders Feature, a podcast powered by Closers.io, where we dive into the journeys of innovative entrepreneurs and explore the road ahead for them and their companies. I'm your host, Zach Young, and in each episode, we uncover the stories behind impactful ventures, the challenges faced along the way, and the strategies driving their future growth. Today, we're joined by Dr. Santina Wheat, MD, MPH, an academic family physician turned career and life coach who helps overwhelmed healthcare professionals overcome burnout, reclaim balance, and rediscover purpose in both their professional and personal lives. With deep experience in clinical medicine and a passion for guiding doctors and healthcare workers toward joy and fulfillment, Tina equips her clients with structured strategies for setting boundaries, managing chaos, and building sustainable career paths that align with their values. She's committed to helping others transform burnout into calm clarity and purposeful momentum. Tina, a very, very warm welcome to Founders Feature.
Thank you so much. Thanks for having me.
Absolutely. It's going to be a great episode. We have a lot to dive into. Before we do, I do like to start with your background, though. I know I touched on it briefly, but just tell us, before coaching, before entrepreneurship, can you tell us what were you doing then? And what was really your inspiration to get into this space?
Absolutely. And I will provide a little bit of a caveat that I am still doing what I was doing then. So I am a family physician by training. And so that means I get to care for people across the lifespan. So I have delivered babies, I take care of newborns, I care for people who are my age and just sort of trucking through life. And then our older generation as well up until death. And so I really do it all. But the majority of my job really is also teaching. So I train future family physicians or family physicians that are in that aspect of their career during their supervision time. And I spent most of my time working at a federally qualified health center, which sees folks who are uninsured or on Medicaid primarily. And really just found that I was that person that was constantly working, constantly moving, and not really taking the time for myself. Like many high achieving people, I just thought that I had to push, and that was how you got ahead. And then my mother died, and then the pandemic happened. And it was one happened. My mom died, and then a year later was when the pandemic happened. And so it was a really hard hit. And I just realized at some point that I couldn't keep going that way. And then what I found was most of the folks that were out there for folks in medicine who were feeling burnout or were looking for another way were encouraging us to leave medicine or at least decrease the amount of time that we are in medicine. And I don't know about you, but I would really like there to be doctors to continue to care for me as I age and to care for my family and my children. And so there was a lot of go into real estate. There was a lot of do this side practice, all of which are wonderful things. But I really wanted there to be somebody that could say, you can do this, you can make some shifts, and you can still stay in this career that you have worked your entire life for, that you've given up so much for, and that hopefully is something that you were called to do in the first place. And that there is a pathway to that can allow people to feel like the career is actually sustainable and that they can still enjoy themselves and still enjoy their home lives and have fun with their friends. And so really it was me trying to solve the problem, solve that gap for what I didn't feel like I could really find for myself. And so I do still work full time. I do still train other family physicians. I'm a program director, and I love that part of my job. But coaching is different because it allows me to help people find fulfillment in a similar way, but I don't have to evaluate them. I don't have to be the person that's the bad guy for them. I just get to support them on their journey to finding the best version of themselves.
Yeah. Love that. Quite the journey. And I couldn't imagine. I'm obviously not in the healthcare field, but we all heard about what it was like in 2020, 2021, being in that place. So our hearts all went out to you, but obviously you guys are still saving lives, doing things that need to be done. So lots of love there. Dr. Santina, I'd love to ask, you're still a full-time physician and you're a coach as well. How are you balancing the two? It's a Friday afternoon. You're here talking to us. So how are you balancing the two of that?
So I will say one of the things that is my priority in life is being able to have flexibility. And so I've never been somebody that has hated the idea of working in the evenings or working on the weekends. I actually chose schedules for much of my career that would allow me to work the weekend so that I could have a day during the week off. That was something that was a priority for me. And so this feels not that much different. I find great joy in doing this. And I think that when you find something that helps fill your cup, that helps you really give you energy, then it's easier to find time for that. So I'm not spending 40 hours a week working on my business. I am spending a lot less time than that on it. But the thing is, some of the tools that I'm learning and that I have used for coaching, are really specific to my clients, but I can sort of transition them in a different way that I do for my learners. So I feel like a lot of the things that I have done for my business, I've been able to repurpose in a different way and then use for my day job as well. And so I
Hmm.
just do my best to find where that overlap really can exist.
Yeah. I mean, you're practicing what you preach. You're
Mhm.
you're finding the time, you're creating the time
Right.
for what you want outside of work. So I'd love to know on the coaching side, just walk us through how are you working with your clients? How do you structure your work with them, especially since you are limited on time? Walk us through that process.
So, most of the people that I work with are going to be like me. They feel like they are overwhelmed and super busy and don't have that much time. So, I try to find high impact times that really work with their schedule. Usually, that ends up being weekends or evenings because that is not when they are on the clock. And so, that works for me. I didn't mention I do have a family and my kids are busy enough. And so, that works out. So, when they're at dance, then I can be doing this. And so we will find time to be together to sort of walk through what are their challenges, where are they getting stuck, and how can they move forward. Usually we're chatting virtually. And then the other part that has sort of surprised me about this is it has opened the door for me to go and speak at different institutions and talk about different strategies that people can take on for themselves. And so I am always surprised when I get those requests, and I've started to lean into them a little bit more of offering them of what things can you talk about to our entire team that can be strategies to help them get started because not everybody realizes that they are right for a coach or maybe doesn't see the benefit or is worried about the cost of it. And so when a department can do that and bring me in or an institution can highlight it, then it has this amazing effect of helping the individuals, but also showing them that their institution actually cares about their well-being and figuring out a way
Mm,
to make things better.
yeah,
So that
that's a
has been
good
the newer
start.
way that I've been helping people.
Absolutely. So very one-on-one, right?
Mhm.
Direct time with you. I'm curious, is there a certain time frame you're typically working with people for, or does it kind of vary?
It really varies. I think when I started coaching, I was given the advice, oh, it has to be 12 weeks. It has to be once a week for you to have any sort of experience. And I think one of the things about someone like me is that I don't really buy into that. Like that was part of what turned me away from the idea of coaching in the first place, was that it had to be this specific structure when that doesn't necessarily work for somebody with my lifestyle. And so I, of course, have standard plans that I will do for folks. And I think that once a week is a lot for someone in healthcare. So I typically say once every other week. And then have a period of time that we can work together, whether that's 3 months, 6 months, or is it just I just need a few hours just to plow through how do I think through these things? And so we can do just one-off sessions as well. And
Mm,
sometimes that's been helpful for people just to have an unbiased person to talk through the challenges that they are facing, whether that's considering a new job or how do they approach a specific situation.
mm, got it. Okay. You mentioned you're doing some speaking, which I'm sure
Mhm.
is a great way of, getting your name out there, of course. And I'm sure, people in your area, they know you. But how else are your clients currently finding you to work with you?
Um, some of it is just word of mouth. Some people know me from other experiences. They've seen me show up in committees that we've been on together or have seen articles that I've published. I haven't really published a whole lot about well-being, though I publish about education a lot. And so the folks that I am supporting are often folks in education, as it turns out. Some of it is via Instagram, some of it's via LinkedIn, and then some of it I don't always know. So I'm always happy when those pop up.
Yeah, you get essentially a free lead, right? You're like, I don't know where that came from, but I'll take it. Very good. So Instagram, LinkedIn. I'm curious, which one is your favorite and why?
Um, I will say I'm getting older in life, and so I think I liked Lincoln a little bit better. And I think part of that is just because you don't necessarily have to do extra steps. Like I like that I can share a LinkedIn, have the link right there, and somebody can just get to it without having to comment this word and get this thing or go to another place to find the link. Um, Instagram is great, don't get me wrong. I enjoy it, but as somebody that like just wants to get things done myself, having everything in one place can sometimes feel a lot easier.
Mm. You know what? I was going to guess LinkedIn, but not because of age. It was not because of age. It was really just because doctors, people, and that
Sure.
kind of stuff, education, very
Hmm.
professional.
Hmm.
Right. And hey, LinkedIn, we all know it's the button up, suit and tie, professional place. So that's funny. That is funny. We talked a little bit off air about the podcast. Could you tell us
Hmm.
a little bit about your podcast?
Yeah, so I just recently launched a podcast I'm really excited about. It's called The Hidden Load, and it is specifically for educators and leaders in medicine with the idea that all of us walk around with this stress and concern that we are hiding from everybody else. So it's a hidden stress. And the point of the podcast really is to allow my listeners to know that they're not alone in feeling these things, that all of us are facing them. And then also to provide some strategies on how they can combat those feelings or work through them or move forward. And I'm really excited because I was just able to get it so that if someone listens to my podcast and they are in healthcare, they can actually get continuing education credits, which all of us need to maintain our
Hmm.
licenses. And so there's credits for nurses, there's credits for physicians. I believe that the credits also work for physician assistants and nurse practitioners. And so I'm just really excited that people can work on themselves and then get the credits that they need for their state licenses and their professional licenses.
That's a great way to grow your audience. Are you kidding me? Hey, come get some knowledge and take care of some credits as well.
Yeah.
That's next level right there.
And the amazing part is
Absolutely.
it's free. They don't even have to pay for that. I'm amazed at this model and seeing interested in how it's going to grow for everyone in healthcare.
Very cool. A lot of people come on the show, they want to start a podcast, right?
Mhm.
But some people, it could be a little scary, right? There's a lot of software. Do I need the perfect camera, the perfect lighting? How was that process for you? How was the process for you going from nothing at all to, hey, I just posted my first very podcast episode?
So I will say one of the things that I have worked on for myself, that I work on with my clients is to not let perfect be the enemy of good. So if you go and listen to my podcast, it is not going to be perfect. For me, it is more about the information that I'm getting out there and really wanting to be able to help people. Right now, I drive an hour. To and from work so it's an hour each way. So I spend a
Wow.
lot of time myself listening to podcasts. And I just thought, well, what if I was this voice that was here? What if I was that person that people could listen to and I could help them? And that was a great motivator. And so once I did that, I was able to chat with my own business coach a little bit. She was launching one a little bit before me. And so she was able to talk through some of the struggles that she had had. And I did it as simply as possible, as low tech as possible. It is available on video, but it is primarily for the audio, and just chose the systems that allowed me to do everything at ones because I'm a one woman show.
Mm.
And so far it's been fun. And so far the feedback that I've gotten from people who I know will send me a message and tell me what it meant for them or the topic that they really liked has been wonderful.
I love that. It doesn't have to be perfect, but the truth is nothing is ever perfect. So don't let
Right.
that stop you. I
Right.
love that. I love that. Tina, 2026 is slowly, but also I think you could also say very quickly creeping
Very
up on
quickly.
us. Are there any goals you've set for yourself next year, maybe for the business or non-business wise, you're looking to achieve?
Yeah, so I've been thinking about this a lot lately, and I am someone that has been trying to set small goals as opposed to big goals. But with a new year, it does feel like a good time to set big goals. I just recently created a sheet to share with institutions. As I was mentioning, I have been doing more speaking at institutions, and that was a surprise to me in some of this. And so one of my goals is to be more intentional about putting myself out there about offering those opportunities for speaking to go and talk to different departments, different institutions, with the hope that it won't just be speaking, but that it'll let their team members know that I'm available for coaching too. Just
Mhm.
sort of open their eyes to the benefits of it. So that is one big goal, is to be able to speak in institutions across the country. I've sort of been in pockets thus far, and so I would love to expand that, whether it's in person or virtual, but just to be able to still touch different places.
Mhm.
Um, and then I think my other part is to really look into what the benefits of coaching are for folks in my situation. And so, not that that's not known, but in my field, there's a lot of using the word coach and meaning very different things. And so, one of the things that I'm hoping to do is provide some context and clarity about that for folks. That the type of coaching I'm doing is not all about telling you what to do, which is one way of coaching, right? Like that's the coaching that you think of in a sports. But what I'm here to do is to help people figure out that they already have the answer for themselves. They just need an open space to get there, or to provide them a little bit of support in getting there.
Mhm.
So I recently have seen lots of folks naysaying the idea of coaches for physicians, and so trying to um, do some advocacy in some way to decrease that naysaying, if you will, to let other people know that this is a worthwhile thing, and something that can really help them along the way.
Great goal
It's
to have.
it's a
Yeah.
bit of a nebulous goal, but I'm hoping that by changing some of the conversation around it, it'll allow more people to feel like this is a reasonable option for them.
Yeah. You're going for big change,
Yeah.
right? You're looking to affect the whole system. I like
Yes.
that a lot. I like that. If
Yes.
anyone can do it, it's Tina.
I hope
Tina,
so.
yeah, you can. Pleasure having you on. Where can the listeners find you? Where can they connect with you online?
Absolutely. So my website is my name. It's www.santinawheat.com. You can also find me on LinkedIn with my name, but I believe that my link has Tina Wheat at the end of it if you look for it in a link. But I am always happy to connect on LinkedIn. And then my Instagram account is at Dr. Tina Wheat.
Love it. Making it easy on us. Tina, such a pleasure having you on. Thank you so much for your time today.
Thanks for having me. It was great chatting with you.
Absolutely. And that will wrap up another inspiring episode of the Founders Feature. To our listeners, if you enjoyed this episode, make sure to go and connect with Tina on all of her social media and website, and check out her podcast as well. All those links will be in the show notes and description down below. And if you are a business owner, specifically a coach, consultant, or agency owner, and you're looking to scale your business, and you really want to enhance your sales and marketing efforts, visit closers.io to hop on a call with our team and discover how we went from 0 to 30 million per year in less than 3 years. Until then, keep on climbing.